Welcome again to my channel. This is Trev from Trevessence, and today we are going to take a look at what's happening in healthcare. But before we do that, if you are new here, a very special welcome to you. Thank you so much for joining us. And if you are a returning traveler, I want to say thank you for your continued support. In healthcare this week, former Health and Human Services spokesman Thomas Corry has resigned. Thomas Corry, the Assistant Secretary for Public Affairs at the U.S. Department of Health and Human Services, has resigned. He resigned abruptly after just 2 weeks in the role. His departure followed disagreements with HHS Secretary Robert F. Kennedy Jr. and Deputy Chief of Staff Stephanie Spear over the management of a growing measles outbreak in Texas, which has infected at least 146 people and resulted in the nation's first measles-related death in a decade. So far, 2 people have been confirmed to have died from the disease. Corry was reportedly uneasy with Kennedy's muted response to the outbreak. During a recent cabinet meeting, Kennedy characterized measles outbreaks as not unusual. Despite the disease being declared eliminated in the United States in 2000. In a subsequent op-ed, Kennedy recommended that parents consult healthcare providers about the measles, mumps, and rubella vaccine, but stopped short of explicitly endorsing vaccination, stating the decision to vaccinate is a personal one. Corry, a veteran of the Trump administration, announced his resignation on LinkedIn, writing, "I want to announce to my friends and colleagues that last Friday I announced my resignation effectively immediately. To my colleagues at HHS, I wish you the best and great success." His resignation raises concerns about Kennedy's leadership, particularly given his history of vaccine skepticism and lack of experience in government and health policies. The internal conflicts highlighted by Corry's departure may impact the agency's ability to effectively manage public health crises. What are your thoughts on the leadership of healthcare in this country at the moment? Chime in the comments below. In other healthcare news, on February 18th of 2025, Lilama Lay, a 67-year-old nurse at Palms West Hospital in Palm Beach, Florida, was brutally attacked by a patient, resulting in severe injuries, particularly to her face. The patient, 33-year-old Stephen Canterbury, was under a Baker's Act hold, a Florida law permitting involuntary psychiatric hospitalization, when he assaulted the nurse, breaking almost every bone in her face. Following the attack, Canterbury fled the hospital, but was later apprehended running across the street. Witnesses reported him making derogatory remarks about Indians, leading to a hate crime enhancement on his charges. He has since been charged with second-degree murder. The nurse's family and healthcare advocates are now calling for improved safety measures in hospitals, including increased security and better training for handling patients with mental problems. A petition advocating for stronger protections for healthcare workers has since garnered over 10,000 signatures in 3 days. This incident has intensified discussions about workplace violence in healthcare settings, highlighting the need for systemic changes to protect medical staff. In recent days, there have been numerous instances of healthcare professionals being assaulted on the job, some of whom have lost their lives. Chime in the comments below and let us know what are your thoughts and how we could improve the safety of healthcare providers in the workplace. That's going to be it from me for today. Until next time, this is Trev from Trevessence, where your journey matters.